Very warm welcome, everybody, particularly to both fellows and guests of the Society tonight. It's a real pleasure to welcome you to 2024's presidential address. I've first been tasked to remind you of health and safety procedures. So there is a fire alarm goes off. There is no plan. So I've been told not to tell you to run, but to tell you that if you hear the fire alarm, to follow the staff members who will be in high-vis jackets either through the exit that way or the exit that way, and the meeting point is downstairs in that corner over there, but I'm sure it will all be fine, and I don't expect we'll have any fires, but you have the health and safety just in case. So I would really like to introduce, although he probably needs little introduction, our president, Andy Garrett. Andy is the Executive Vice President of Scientific Operations at the clinical research organisation ICON plc. Where he's responsible for the strategic direction and operational delivery of a range of clinical trial services. He's worked extensively in the areas of rare disease and held various management positions in biostatistics across pharmaceutical industry, including being the Vice President of Biostatistics, Medical Writing and Regulatory Affairs at Quintiles, which is now IQVIA. So Andy's had long involvement in statistical system across the UK. He's a member of the UK Statistics Authority Research Accreditation Panel and was asked in 2016 by the National Statistician to undertake an independent review of ONS methodology. However, Andy's involvement in the RSS has been phenomenal. Andy's been a fellow for over 30 years. He was elected to RSS Council in 2003. He served on the executive committee from 2004 to 2010, became vice president for professional affairs in 2008. In 2013, he chaired the long-term strategy group that led to the RSS tagline, Data, Evidence, Decisions, and has been instrumental in the initiatives such as Statisticians for Society. He recently set up the data science section and was the first chair of its group for 2 years. And for 2023 and 2024, he has been president of the RSS. So, Andy, over to you.
Thank you, John. Very kind of you. Inevitably, you stand on the shoulders of others that have gone before you, and inevitably, what you present in a presidential address has been covered by other people. So what I did, I thought I'd start with, in my introduction, essentially just picking up some quotes from various presidents before me. And it gives you a flow a little bit about the talk today. I've also got a quote there from Ian Diamond, who's our national statistician. So David Hand said statistics is so ubiquitous. And it's true that being the president of the society, you get to play in so many different areas, and that's the exciting bit. And I hope I'm going to show you that by covering many topics today. But if statistics is ubiquitous, then so are data. And I'm going to be talking today a fair amount about data. In fact, the focus and the spotlight will be on data. But data and statistics are sort of equal in many ways, in the sense of data becomes statistics, and statistics then become data, which becomes statistics, etc. So there's a sort of an iteration or a cycle that goes on. So that distinction between data and statistics will also come out a little bit, but also the similarities between the two. Sylvia Richardson, in her presidential address, said that data never exists without relation to something, and the method used to collect the data needs to be scrutinized. And again, that's a focus of what I'm going to be discussing today, is around the data generating process and the data around the data. So basically the metadata. And data never exists without relation to something. So I'm going to be giving you some examples of during the presidency that I've been involved in. So climate change, COVID, official statistics, and then the interesting topic of AI. David Hand, again, raised the issue about public awareness. How do you raise the public awareness about statistics going back in 2009? John Pullinger, in his address, spoke about the limited awareness or attention given to statistics, and a greater understanding will improve trust. David Spiegelhalter talked about trust in his presidential address. And John had high hopes that by 2020, that would all change. And to some extent, it did change, because we had COVID. And Sylvia and then Deborah, both their presidencies were sort of defined by that to many extents. So, as Ian Diamond said, one of the things to come out of this dreadful pandemic was that people across the country became more data literate and more demanding of the data, more able to interpret the data. And that's a theme I'd like to pick up on around the detail, about providing more detail, allowing people to question things far more. And then Peter Diggle, in his presidential address, talked about data science, threats and opportunities. And we move on from data science to AI and the same sort of thing, so threats and opportunities. But the devil starts with the detail, and the detail starts with the data. So this is basically the format of the presentation today. We'll start with the introduction, which I've just done. We're going to talk about the data generating process and the different processes around and the data about the data. Then to give us some examples to illustrate the points around climate change, COVID-19, official statistics, and AI. And that links in a little bit to the society and data, the society and trust, the society and collaboration. And then I'll have some concluding remarks. So the data generating process. There are two key areas, or two key processes, methodologies that statisticians use that enable you to create probability statements, to talk about bias, and to basically have a methodological approach to the robustness of the conclusions from the data. And they're randomization and random sampling. And I want to concentrate a little bit on those two particular methodologies. And I'm going to talk about observational data, the census, administrative data, smart data, simulated or synthetic data, and then metadata. So I'll go through these relatively quickly. So randomization. So when the aim is to compare one intervention with another, so I've got a clinical trials background, inevitably I tend to start I'll go into treatment groups. But could be any intervention, doesn't have to be around clinical trials. And in fact, if you look at R.A. Fisher there, who are past president on the right-hand side, it was R.A. Fisher that between the two world wars essentially developed randomization, more in the context of agriculture. And it was another president, Austin Bradford Hill, who basically brought randomization into clinical trials in the late 1940s. And essentially what randomization does, it's tossing a coin. So in this room here, you toss a coin to see whether somebody received treatment A or treatment B. It is simple as that. And ensures that bias is controlled for, and essentially over all randomizations, this sort of frequentist approach, over all randomizations, treatment groups or intervention groups are balanced for factors known and unknown, measured and not measured, that impact outcome. And it's as simple as that. But the whole variations on a theme as well. We have Stephen Sen in the audience, who's an expert on crossover trials, where you randomize the treatment sequences. You have cluster randomization, where you maybe randomize schools or health authorities or any unit that you want. So, but the important thing about it is it's not limited to clinical trials. So agriculture, about crop yields, animal research, and social science are all examples of where randomization is effective and leads you to be able to draw causal conclusions around the treatment effects or the intervention effects. And that's really important because it's at the top of the pyramid in terms of the causal approach. And you hear lots of talk about causality, but really randomization is the main approach at the top of the pyramid in terms of having causal relationships. The next one is random sampling. And here where the aim is to obtain an unbiased estimate of some characteristic of a population. So essentially you've got a broad population of people, and you simply take a random sample from that, and essentially you ensure that every member of the population has a known and usually equal probability of being included in the sample. And if you took K people, that sample of K people has the same probability of being chosen as another K sample as well. And here representation is very important. So what you are is trying to have a sample that represents the population that you're looking to estimate, which is very different to randomization. So randomization, you don't actually need a representative sample. You need people to meet certain criteria, but as anybody knows things like clinical trials, patients, you don't randomize a group of patients in one go. Generally what happens is patients appear over time, at certain centers, and it's never representative. But the idea is you estimate a treatment difference, and then that treatment difference is portable to other groups. Random sampling, very different. You are trying to have a representative sample from that population. And again, you know, the sampling schemes here can vary. They don't have to be people. They can be businesses. So a lot of official statistics around business data. You can take a sample of businesses. In manufacturing, if you want to know that your process is in control, you're doing manufacturing and look at defects, you take random samples from that process as well. And the person up on there on the right-hand corner is Sir Arthur Bowley, again, another president of the RSS, who certainly extended random sampling to stratified random sampling. And a bit like randomization, there's a whole range of things you can do that are variations on a theme in terms of this. And there's a lot of work around missing data and a whole range of small samples, etc. There's a whole range of things. So they're the two key tools that statisticians have to be able to draw reliable conclusions from the data. So then move into observational data. And observational data is really an umbrella term. So you essentially observe things. You can do that retrospectively, so you can go back and you can look at data for patients, say electronic health records, or you can do it prospectively. In fact, some clinical trials are prospective observational studies. So it's exactly the same as a normal clinical trial. You just don't have, say, 2 or 3 treatment groups. You just have one, and you observe that group through time. And observational data comes very much from epidemiology and social sciences. And maybe a good example is the National Child Development Study. This was in 1958, and it took all the children born in the UK in a week in 1958 and followed them through as a cohort. So there's no intervention, etc. They're just looking at things like education, health, and various other characteristics. So basically that's a prospective, but some of them are retrospective, and they can be a mixture of the two. The next one is the census. So the first census in the UK was done in 1801, and other than in World War II, essentially it's been every 10 years. So you have the data on essentially trying to get it on everybody, the whole population, and it's taken on a single day in the calendar. So every 10 years, a single day, everybody has to fill in the information. And this really is more for government planning. And this is the definition here from the ONS. So the census asks questions about you, your household, so you have to answer questions about everybody in your home. In doing so, it helps to build a detailed snapshot of our society. Information from the census helps the government and local authorities to plan. You might find that hard to believe, but that's what is supposed to happen. And to fund local services such as education, doctors' surgeries, and roads. Then we move on to administrative data. And this is really interesting, administrative data, because this is a lot of pressure within government agencies to use administrative data instead of random samples and surveys. So essentially, this is the definition from the Administrative Data Research Network, that administrative data is information collected when people interact with public services, such as schools, the NHS, the courts, or the benefits system, and it's collated by government. And the important thing about administrative data is it is around the service that is being offered. It is not created for research purposes. And this is part of the challenge with administrative data, because you never quite know how the data is being completed. You never quite know the order that the data are completed, and how people filling in a form, which then gets digitalized at, say, a job center, what they regard as important, because it's not for research purposes. So they might just put random information in, they might put default information in. So you never really quite got so much control over the process. So though potentially it's a data all, and you have it on everybody, it doesn't necessarily solve all your problems. And I think, I did see somewhere that I think national insurance numbers, I think there are more national insurance numbers than there are people in the UK. So just to illustrate that sometimes this doesn't really solve the problem with administrative data. Smart data, and this is a definition from Smart Data UK, is data generated through engagement with digital systems, devices, and sensors including mobile apps, navigation systems, say in your car and on your phone, social media, sensors in consumer devices, and the environment and digital transactions. So this is an area where sometimes it's free, but the cost you're paying, the price of having access to social media, is giving your data away for free. But it's not only from people; it can be your gas and electric meter sending information out. So this is essentially smart data. Then you have simulated or synthetic data. So this really is data made up, but it's made up for a useful purpose. So it's based upon a probability distribution, and essentially what you use it to do is to generate some data that you can use to normally test various assumptions and to actually look at compare methodologies. And often you use plausible assumptions and extreme assumptions, but essentially you define a probability distribution, you generate a lot of data, and then you use that to compare the performance of statistical tests, and sometimes to design studies as well. And this is quite a common way of doing it. Synthetic data is slightly different, and it tends to be real data where you change some characteristics of the data, so the overall properties remain the same, but you can't identify individuals from it. And again, this is tended to be used in testing scenarios. But interestingly, if you look at something like AI with the large language models, there's something called hallucinogenic AI, which I'll talk about a little bit later, where AI generates, or these large language models generates new things that don't exist, where it'll create references that don't exist. So in some respects, you could argue that this is sort of simulated data. Then the final one is metadata. This is the one I think is always underestimated. It's the data about the data. So every single data point has data around it. And you can think about it in terms of your social media and other things, but it's basically who created it? What created it? Was it a machine that created it? When was it created? Where was it created? It includes the structure of the data, so the variable name, the label, the format, where it is stored, how to access it. It talks about as well about how data are derived from other data. So even something as simple as calculating age from, say, date of birth to the current time point, there are lots of different ways of calculating age. And I can assure you, in clinical trials, you can guarantee if you get two programmers, one will calculate it one way and somebody will calculate it another way. So you end up with those inconsistencies. So even something as simple as age is not quite so straightforward, because what happens if there's some data is missing? How do you account for the missing data? And it also is around how data is joined, merged, and linked together as well. Right, so let's get on to one of the four topics. So climate change, and we have a climate change task force, so some of the work here is based upon the climate change task force. And Deborah Ashby, I think you said in one of your presidential address, an area the founders did not consider is the environment, noting the long-standing contribution of statistics and statisticians in that area. And maybe it's not surprising that our founders, going back to 1834, weren't aware of climate change and didn't think of the environment in that context. But on the right-hand side there, this is interesting. This is actually from would you believe, a paper in New Zealand, which in fact is quoting a magazine that was published in Australia. And this goes back to August the 14th, 1912. And it says, the furnaces of the world are now burning about, I think it's 2 billion tons of coal a year. When this is burned, uniting with oxygen, it adds about 7 billion tons of carbon dioxide into the atmosphere yearly. This tends to make the air the air a more effective blanket for the Earth and to raise its temperatures. Interestingly, the effect may be considerable in a few centuries. So there you go. So it was known about going back all those years. So when you come back to climate change, and we'll come on a little bit later to the 1.5 degree target. If you want to think about targets, first of all, you have to think about a baseline. If you think about change, what's change from when? So these are some data from our World in Data. Oh, sorry, one world in data. Our world in data, sorry. And this plots out annual carbon dioxide emissions, obviously estimated, going back from 1750 to the present day. So why, or how would you define a baseline? So the IPCC have defined the pre-industrial baseline as 1850 to 1900. So again, predates the formation of the RSS. You might think, well, that's a bit odd, isn't it? Because the UK had an industrial revolution way before that. So in the middle of the 18th century, and I've drawn that on the left-hand side. But of course, in the context, it was the UK that had an industrial revolution, but the world is a big place. So as other countries develop, like the US and China and India, you can see the takeoff of carbon dioxide emissions through time. And of course, carbon dioxide is not the only greenhouse gas. You've got methane is another clearly important one. But I think this illustrates the point quite nicely about why that 1850 to 1900 was chosen. It's a sort of pragmatic choice. You know, it could have been a little bit earlier, it could have been a little bit later, etc. So why was that chosen? So in the reality, it was chosen because that's probably where you had enough data to estimate it. So how are the data? Where do the data come from? So this is a quote from NASA. It says, today's temperature data come from many sources, including more than 32,000 land weather stations, weather balloons, radar, ships and buoys, satellites, and volunteer weather watchers. So essentially it's made up of two things. It's made up of land surface temperatures and sea surface temperatures. If you go back through history, where these have been taken, they've been taken for a long time. The land surface ones are taken where people generally lived. So if you didn't live in a certain place, you didn't get any temperature data from those places. The sea surface temperatures were based upon where the sea lanes were. So they weren't randomly chosen. You didn't have boats going around the world just taking samples. In fact, it was a bucket of water. You put your bucket in the water and you poured it out and you took the temperature. And in fact, during in World War II, this was quite disrupted because the sea lanes were changed and a lot of the data actually came from the American fleet. So the data that you're using to calculate some of these data, or some of these monthly data and yearly data, they're quite variable. And there's a whole process called homogenization, where essentially you take into account all these different things. And even with the land one, things can move. So it can move from one part of the world, or one part of sort of Heathrow to another part of Heathrow, and that has an impact depending on where it's based. But generally speaking, with these data, you want data that is well spread out. Because if you have data that's very close together, or you have sensors that are very close together, then they inevitably are going to be highly correlated. You don't really want correlated data. You want data that has broad coverage around the world. So that's a little bit about the data. So limiting global warming to 1.5. Everyone's heard of 1.5 degrees as being the limit, and it's now defined as being a defense line. It's mentioned in COP16 in 2010, the Cancun Agreement, while the Paris Agreement at COP21 formally adopted 1.5 degrees as the limit to essentially keep the increase to 1.5 or 2 was also added in. So how is that defined? Because it's easy to say 1.5 degrees. Everyone says, oh yeah, 1.5 degrees, we all talk about it. But actually, how is that measured? And in fact, it's quite interesting when you start looking at it. It's not obvious how it is measured. And in fact, I have at the end there, when it comes to the Paris Agreement or the Paris Statement, which everybody signed up to, it talks about 1.5 degrees, but it actually doesn't say how it's defined. So when you go back and look at it, the IPCC 6th assessment report does define it. So it's not in the Paris Agreement, but it does define it as a 20-year moving average. So essentially what it's saying is for 2024, you need to get the data 10 years before and 10 years after to be able to calculate that moving average. And for people who are the statisticians amongst us, you also know that if you have an even number for a moving average, you've got to take the two middle points. So actually, I mean, the crazy thing about this is there's not even a single year which you could define. It would be the average of the middle 2 years. But that seems really remiss to define something in terms of a moving average where you won't get the data until you won't know until 10 years hence that you've crossed the line. So this is starting to get far more debate now, including from our climate change task force. And we've moved to a modeling approach. So on the left-hand side there, you've got that, basically this is from David Stevenson, who's on our task force, and you can see the grey up and down, the vertical bars. That's essentially the monthly data through time. And what he's done, he's used a generalized additive model, and there's lots of details about that in the paper. And essentially what we're looking to do now, as other people are, including Betts et al. In 2023, is actually model it, including with confidence intervals, so you can have a better prediction or a better understanding of when 1.5 degrees is crossed. But I think it's really remiss that when you think about what I'd call here, the devil's furnace. This is, so my first devil. That really little control over that at all. So no one really knows when 1.5 has been passed. And even the big debate now, did 1.5 happen last year? Does it happen this year? That seems to be a really poor way of going about managing something as important as climate change, so having so much debate. So here, devil's in the detail, really need to tie down. So, onto the pandemic. This is for Deborah and Sylvia, which you obviously had nightmares about this going back many years. Going back a few years. So, I think COVID pandemic, was a big data pandemic. The world was awash with data. Near time, daily data. I don't think it was an AI pandemic. I didn't see a lot of use of algorithms and predictions, but in that respect, it was a modeling pandemic, but it was a big data pandemic. And then we had data on infections, we had data on hospitalizations, we had data on deaths, and then later on, we had data on vaccinations. And the public did become far more interested and aware and kick the tires on some of these data. But let's take one of those, just take a simple example here of death with a laboratory-confirmed positive PCR test. Should be quite simple. However, it took a long time for the data about the data, for the metadata to reveal itself. That essentially, that definition was having a positive PCR test regardless of the time since the test. Less of an issue early on, of course, so when January and when the tests start to come out, it's not so much of an issue. As you start to go through time, and particularly with deaths increasing in the elderly population, that becomes far more important. So it took till August 2020 to clarify the definition and to modify it. And that definition was changed to essentially a PCR test, the first PCR test, within 28 days. And overnight, that reduced by 13% the overall cumulative COVID-19 deaths. Okay, it's a big, big impact in terms of planning and wanting to know how you're doing in governments and how you're doing with health policy, etc. So, the heroes come along, the statisticians, led by some of the people in the RSS. And I do think that this had a massive impact in terms of managing COVID. And we all know COVID has been really difficult. But I do think use of some of these standard techniques really brought a sense of robustness to decision making. So those tried and trusted methods brought both rigor and changed the course of the pandemic in the UK. So let's talk initially about random sampling. So really, the UK led the way in terms of obtaining a random sample. So when we talked before about testing, anybody could go for a test. So it wasn't a random sample. So you never really knew when you had what number of positive tests were or what percentage were positive tests and how many tests are being done. Didn't really give you an awful lot of information. So there were two surveys that were introduced. The first one run by Imperial College, which essentially used an NHS list of GPs. So it was a pretty much near universal coverage in England. So it wasn't outside of England. And over the course of the pandemic, I think about 2.5 million swabs were processed through this way. And essentially, this is a classic example of reaching out to essentially almost a random sample of the whole population. It had to be aged over 5, asking them to register, sending them some tests, getting the data back, and then that feeding back into getting now actually estimating prevalence rates. So really important. Then the other one is the ONS CIS survey, so the COVID infection survey. This is slightly different. So this was a random sample of households, and the ONS has a very effective method of basically sampling households all the time. So they already had this in place about being able to go to households and do random sampling. That was a UK-based one, so it had a broader coverage than REACT. And interestingly, because it went to households, it was also starting to be able to look a little bit about transmission. So the REACT one couldn't do transmission, whereas when you're looking at household, you can start to look at how many people in a household were infected. Now, some of the problems with these things were low response rates. So I think over the course of it, was a response rates around about 20%, which does undermine things to some extent. But these really started to feed through and provide valuable information to plan the pandemic, or plan the response to the pandemic. Next one is the UK recovery trial. This was in hospitalized patients run by the University of Oxford, and initially it used repurposed drugs and employed an adaptive design, which essentially means you can add treatments in, you can take treatments out, etc. This looked at 28-day mortality, and in June 2020 was the big breakthrough. So dexamethasone, which is a high-dose steroid, was shown to be effective in reducing 28-day mortality. That had a massive impact, not only in the UK, but also across the world. So someone using those high-dose steroids. Hydroxychloroquine, I think how you pronounce it. The important thing about that is it was confirmed to be ineffective. And if you think about, if you go back to those heady days of COVID and Donald Trump, it was Donald Trump's favorite drug. He was the one that was promoting it. And if you think back and you forget a little bit about that pandemic, all the crazy things like drinking detergents. I seem to remember something about, was it putting light up your bottom? That was another one. I seem to remember that. Anyway, there was these crazy treatments. But anyway, what this did, this confirmed that hydroxychloroquine was ineffective. And that was great because it took it out. It wasted, there was a lot of resource, a lot of money being wasted. And initially all that came from observational studies. So the idea that it worked, particularly it came from a lot of China studies, but also in the West as well. And this was essentially extended new treatment. So the recovery trial had a massive impact. And then we move on to the vaccines. So, these international double-blind placebo-controlled trials in volunteers looked at symptomatic infection prevention. Those trials are big trials, 30,000 subjects, 44,000 subjects, massive compared to what we normally do in clinical research. And by 2020, within the space, December 2020, in the space of 12 months, the first mRNA vaccine was approved. So it was the Pfizer vaccine. Interestingly, used a Bayesian analysis, and I saw Andy Grieve here, who was ex-Pfizer and not ex-Bayesian, is a Bayesian. So therefore, Andy, you had obviously a big impact. But actually, with that one, you didn't really need to do any statistics, frequentist or Bayesian, because the results were it cleared the bar so well. However, vaccines and transmission. So we talked a little bit before about transmission. This comes back to the devil again, to some extent. How a lack of understanding of the data generating process can easily lead to false claims. So if you don't understand the process, you can start to get misinformation or disinformation. So Dutch MEP Rob Roos stated that a pharmaceutical executive revealed that COVID-19 vaccines were not tested for their impact on transmission prior to release. And that is true. That is true. In fact, there's no regulatory requirement to do that. But that's not the main point. And what he said was, this is scandalous. Millions of people worldwide felt forced to get vaccinated because of the myth that you do it for others. Now this turned out to be a cheap lie. And then in an email to Full Fact, and I think I saw Will here, who was with Full Fact probably at the time, Governments worldwide have introduced COVID mandates and passports that had enormous impact on millions of people. They did so by explicitly arguing that vaccinated people cause less transmission of the virus. This proves that this assumption by governments for which there was no evidence has been provided. So it's not an unreasonable question to ask, though, is it? No, I think it is a fair question to ask. Why did the vaccine trials not evaluate transmission? But really, this is a misunderstanding of what you do in clinical trials. So in clinical trials, you randomize subjects to, in this case, different vaccines, or vaccine versus placebo. The endpoints that are recorded are for those subjects. They're not recorded, so this is sort of symptomatic infection, they're not recorded for people who aren't in the trial, who happen to interact with the people in the trial. And in fact, you'd have to get consent of all those people, which is almost impossible to do, to even try and gather data on them. So clinical trials are not about the people you interact with, they're about the people that get the vaccine. Now, you could argue that you could measure the indirect effect of transmission, because you could argue if you don't get infected, then you can't transmit. And so by sort of logic, you would say, if you can reduce symptomatic infection, then so long as you don't change the behavior, which is a big assumption, then it will have an impact on reducing transmission. But it can't be quantified in those clinical trials. In fact, the data came much later from some observational data based in Scotland using healthcare workers, where they looked at healthcare workers and they used healthcare records and looked at the infection rates in their family of the healthcare workers that were vaccinated versus not vaccinated. And that showed a 30% reduction in transmission, and they reckoned that that was an underestimate. Now, I think the question here with that MEP was he deliberately trying to mislead? Was he just being devilish? Did he want the publicity? Did he just not understand the process? Did he just not invest the time in understanding the process? Or did the pharmaceutical executive that he interacted with not explain it very well? I suspect it was all three. So let's move on to official statistics and inflation. So we've got Jill here, who's done an awful lot of work on this. So no consumer price index can meet all the user needs, and the RSS has been heavily involved in inflation and RPI, et cetera, over many years, going back, certainly 2018 was heavily involved in these things. But a measure for macroeconomic purposes, such as target inflation, is different to one used to understand the impact on households. And Jill Leyland and John Astin have worked on this over a number of years. So the society has campaigned for greater granularity in relation to household inflation, in terms of how different groups in society are impacted by rising costs. And it's highlighted the importance of the production and regular publication of HCIs. So what do HCIs do? They look at how much disposable income you need to have in addition to compensate for inflation, to maintain things as the same. And what it does, it breaks things down in a more granular way. So HCIs, you can have an overall HCI, but you can also look at income groups, so the different deciles. You can look at housing status, private renters versus outright owners. You can look at households with children, and you look at retirement status. So in this context at the moment, if you look at households with children, for instance, have a higher inflation than the average. So these things are important in terms of policy. Now, importantly, again, this is where the devil comes into the detail. Consumer price index does not include mortgage and loan interest payments, which is why if you've got a mortgage and the interest rates have gone up, you're going to have a higher inflation. If you're going to a payday lender and you're in a deprived community, your inflation is going to be a lot higher than other people. And actually, you've seen this over time. If you look at the data, some of these more deprived groups really struggled during the last 12 months when inflation was high. So we talk about what CPI was, but actually for these people, it felt very different. The world felt very different for these people because they were experiencing inflation in a different way. And CPI also gives more weight to expenditure, because it's an expenditure measure, gives more weight to wealthy households, because wealthy households spend more money. So this is where, the detail is important. And I went back and had a look at this. This is a quote from Harold Wilson. So this isn't new. So Harold Wilson, back in 1973, again, this was in his presidential address, referred to developments including a new index based upon the expenditure patterns of pensioners, and later developments based on social surveys and the new general household survey in particular will enable us to form reliable estimates about the impact of individual events within the family. So this is not new that we should be doing this, but it's really good to see that the ONS is now producing these on a quarterly basis, and I think we've had 3 sets of quarterly data now coming from the ONS. So what about data generation in general? So this is some information or some work done by Johnny Rung, who's here today as well. He's done some excellent work in this area. So we're looking at how does the public perceive some of these official statistics. And what he found was that the public assumed that the headline employment figures are based on claims data and tax data, which come from government departments, rather than large surveys from an independent statistics agency. So essentially they assume that the admin data that we all work with produces the employment data or the unemployment data. But it doesn't. It comes from surveys. I don't know how many people knew that. I didn't sort of really understand that. And he also spoke about macroeconomic measures created by economists, policymakers, and researchers were not designed for public communication. So again, he gave some examples around how unemployment might be relatively low, but in their community, they might feel it's very different. And it's because you've got a lot of people in that community that are not working because of sickness, etc. So it's how do you come up with more intuitive measures, not replacing what you have, but more intuitive measures. So really it's that opportunity, I think, with official statistics, is not to replace what's being done, but it's an opportunity to go broader and deeper and to supplement with other measures. And it's interesting, we did some work with the Administrative Data Research Network a number of years ago. But what we also found was that the public assumed that data collected by government for a variety of purposes are used, are shared, and are linked for the public good. So they're really surprised when they find out that they're not. Because it's just a working assumption is I give them the data and surely they must use these data. Now, admittedly, government agencies are going through real changes at the moment. It's not just in the UK, but everywhere. And we talked before a little bit about low response rates. And that's the part of the issue. If you have low response rates, then it undermines some of the work or some of the estimates that are coming out from these surveys, including the employment data. So you're finding that traditional methods such as random sampling are being undermined by those low survey response rates, and there's this pressure now to use admin data. And what we're finding really is that those agencies are going through that transition. And I think the big point to make is that they need to be properly funded to do that transition. They need to be properly funded to run things in parallel, because you have to maintain continuity. And they have to, we want to go broader, we want to go deeper, and they need to have the support to do that. And on the one hand, we've got an investment of £1 billion in AI, but how much are we investing in actually the core data infrastructure, using the good data principles that we like to follow to give us reliable estimates, as you saw from things like the prevalence surveys, etc. So I think it's really important that we keep on pressurizing. We've been doing this recently, putting pressure on government to really fund the UK Stats Authority, the ONS, Government Statistical Services, etc. So artificial intelligence. So digitalization really marked this sort of epoch in data generation. We now have this conversion of text, images, sound, videos, etc. to data. And that's really increased the amount of data that we have in the world. And through the lens of AI, data can be used to inform, just give you information. It can be used to recommend if you're on Netflix or whatever. It can be used to persuade. I'm sure a lot of people are trying to do that at the moment with the elections. It can be used to mislead, as we saw, as we saw previously. It can be used to decide. So algorithms can decide things, and it depends how much human oversight is there over decisions made by algorithms. And they can be used to entertain, and we all love entertainment. And the risks associated with that depends really upon the purpose. So there have been just a multitude of white papers coming out, regulations coming out in Europe and the US. In the UK, we're sort of holding back a little bit on regulation. And it's interesting, there was a white paper came out last year that quoted proportionate, I think it was 68 times in it. And that's really a classic one for statisticians, isn't it? Because we love being proportionate, we love being measured. And you could argue it was the disproportionate use of the word proportionate. So, what we really, this whole thing about lots and lots of regulation, really hard to keep on top of it. And then Peter Diggle, in his presidential address, he again talked about data science. So data science coming before AI to some extent could be seen as a potential threat to the long-term status of statistics, or the stats discipline, arguing that although there's a threat, there's also a greater opportunity to re-emphasize the universal relevance of the stats method and interpretation. I completely agree with that. In AI, we really need to get involved in that discussion, and it's so good that as part of the strategy, we now have an AI working party to pull that together. So then move on to generative AI and large language models. So a little bit like your presidency. And your presidency was defined by COVID. I feel like mine was defined by having large language models, which came out in November 2022. And in fact, I did try using that for my dinner speech a couple of years back and found it was completely hopeless. But anyway, ChatGPT came out, and everybody's using large language models, and we think they're they're down as being next word prediction tools. But are they? Are they really next word prediction tools? I'm not so sure. So essentially, what large language models do, they produce digital outputs, and it can extend from text to producing pictures and sound that others can consume. And it's multi-layered, so deep learning, you have inputs become outputs, become inputs become outputs just within the algorithm. And they have thousands, millions of parameters, which is really counter to a typical statistician who would think about parsimony, so having a model with as few parameters as possible. This is the antithesis of that. So the important thing about that is that humans can consume this, but what happens when other large language models consume that data as training data? So if it's producing output that is unrepresentative or wrong, and you've seen some crazy answers coming out of large language models where it seems to have just gone to Reddit and picked up a crazy answer from Reddit and then basically reproduced it. We'll come on to that a little bit in a minute. So as you start to create these large language models and they get trained on outputs, or they get trained on inputs, but the inputs are the outputs from the large language models, you start to get this undermining of information. When we talk about this existential threat about robots going out of control or pressing the nuclear button, but I wonder whether the bigger existential threat here is just that undermining of the knowledge base potentially by large language models. And it's this question around misinformation versus disinformation. So misinformation very much around not deliberately misleading, disinformation deliberately misleading. So this is just a quick example. This is from the New York Times, and you don't have to look into massive detail. But one on the right-hand side is from the New York Times. On the left-hand side is the output from ChatGPT. And the only word that is different is premiered instead of debuted. Yeah? Now, there's some great stats tools around. I don't believe that's a next word prediction model. And the New York Times doesn't believe that either. So clearly, these models are going to certain places and picking up big content of data. And you start to get into things like fair access. You start to get into copyright. You start to get into plagiarism. So there's no acknowledgement this is from the New York Times. It was behind a paywall. So there's not paying the New York Times to access that information. I think it's part of the lawsuit is that they're happy to be paid as long as actually they select it. So I don't think these large language models don't do exactly what they say they're doing. And this is effectively what they describe as memorizing content. Right, so I'm going to go through quickly now the society and data. So the society's relationship with data goes back to its origins and its founding fathers even. And John Pullinger, in his presidential address, talked about the wheat sheaf symbol to show that the passion was to gather data. This is the RSS. The passion was to gather data from our founders so that they could be threshed to reveal the golden corn. And if you look at the new logo on the, I guess, your left-hand side, that yellow line, that really represents that wheat sheaf. I don't know if people remember that. That's the association between the two. And on the left-hand side there, you can see, I think as John alluded to, data, evidence, decisions. That strapline was produced in 2013. And interestingly, it was Rita Gardner from the Royal Geographical Society that said, you've got to get data in there. It's really important as a society you get data in there. So we formed the data science section in 2017, now the data science and AI section. It was a time when people like John Pullinger was forming the ONS Data Science Campus. People were going to pizza and beer meetings and meetups. Do you remember all those things that happened before COVID? Starting to happen again. We formed the Data Ethics and Governance section in 2020. We had Sylvia's Data Science Task Force, which did a whole range of things around, including real-world data science platform and the Association of Data Science Professionals. And we've now got this AI task force coming through. So we've been involved with data for a long time. So how far does a society move towards data, and does that imply a move away from statistics? And that tension has been carefully navigated by Jen Rogers and people like Sarah, who've been working on the strategy, to use the term statisticians and other data professionals. And this is really well done, I think, because on the one hand, we do want to acknowledge we are still statisticians. There are people amongst us that still see themselves as statisticians, but increasingly it's around data professionals. So I'm not going to go into the detail here, but essentially, I think this is very well navigated moving forward. I want to talk a little bit about society and trust. So David Spiegelhalter, in his address, spoke about the essential role both in improving the trustworthiness of stats evidence as it flows through the pipeline and improving the ability of audiences to access the trustworthiness. And it's a detail that enables the reproducibility and whether claims are valid. But I wonder whether there's more to trust than simply following through the data. And I think part of the trust as well should be the user requirements. So what data do you need to hold governments and other bodies to account? It's not simply a question of the data that you get. Do you understand it? It's also moving beyond that to basically needing data that's important, timely, holds government and other bodies to account. And I think those other bodies would include pharmaceutical industry. It would include large tech. It would include those people doing climate change. And more granular data to be able to hold bodies to account. I think that's a really important part of trust. So, where we've been involved a little bit on this, well, past President Dennis Leavesey did the review recently at the UK Stats Authority. I'm really pleased that she proposed the establishment of a triennial stats assembly. RSS heavily involved in that. It's not that there aren't other aspects or other ways of having user engagement, but really pleased that the RSS are working with the UK Stats Authority on that, representing the users, because it's a really important role for the RSS representing users. It also talked about creating common standards and improving harmonization across the 4 nations. Again, it goes back to the detail. It's crazy. You look at COVID, different definitions of death and how it's recorded, etc. And building partnerships with other organizations to foster relative communication expertise and improve engagement with a wider group of users. And this was a quote from Klaus Moser back in 1980. He was again a previous president of the RSS. I felt the need for a user forum which would help government statisticians develop their work for government as well as for the community as a whole, and which would constructively increase public awareness of the benefit of stats. And I'm hoping that's what we'll do with the triennial review. So I think I'll move on here because of the time. Okay. So society and collaboration. Again, 5-year strategy. Great thing about that is we have 4 values now. We will be inclusive, collaborative, impactful, and progressive. And I think it's really important, the collaborative one. Because I think the collaborative one really is an enabler of the other 3. And we are successful as a society because we've got a great HQ, a great staff in the HQ, but we've also got a great number of volunteers. And it's our fabulous volunteers that enable us to do so much. And we achieve so much more by working with others. Because statistics is ubiquitous. You get involved in so many different areas. So we've worked with Citizens Advice on household cost indices. We've worked with the Council for Mathematical Sciences on the establishment of the new academy. We're working with the UK Stats Authority on the triennial review. And we're working together with the Alliance of Data Science Professionals to accredit courses and come up with professional qualifications. So the opportunity for the society to contribute is basically wider than ever before. So just move on now to some closing remarks. So what does this all mean? So I think ultimately the importance of it really just demonstrates the importance of understanding the data generating process and the data about the data. It has fundamental implications, and it's really important that we understand how the data are generated and how we can use it. And we should be advocates as statisticians, data scientists, and the society for data generation based upon sound statistical principles. The second point is the need to support the public to navigate an increasingly complex world of data. But I don't think complexity shouldn't be an excuse not to provide data to the public and to give the detail. I'm just going to jump here a little bit to a quote. This again from Klaus Moser. This is back in 1980. So, moreover, the public of the 1980s, I did my degree in the 1980s, will be better educated and will more consistently challenge the decisions of government. They will expect to monitor government success and will expect readily accessible, convenient, and intelligible statistics with guidance on quality of data and meaning. 4 decades on, we've got an even more educated population if you think about how many people go to university. So really, this is a time when we should treat people like adults, and we should provide far more information and far more detail, in my view. And though there are risks associated with doing that, I think it's about time we started to be a bit more open, transparent, and a bit more forward-looking in terms of what we provide. So again, closing remark number 3, I think it shows the importance of data provenance. I think with AI, it's really going to highlight the importance of provenance, the importance of the input. So we often concentrate on the outputs of AI, and we often concentrate on the outputs of lots of things, but we should think about far more about the inputs. And I think statisticians and data scientists are really well placed to think about inputs. It's how we design things, how we think, and this is where I think we can have a real value and add to the discussion. And just general theme, I think we just have to remember that inputs become outputs, which become inputs, and data becomes statistics, which become data. It's a never-ending circle. And finally, we need to champion user requirements. So this is something that society's done over many years, and we will continue to do, but we need to champion user requirements so users get what they need to hold government, but also other bodies to account. It's not just government that needs to be held to account. And we need that investment in the UK's data infrastructure. So just some closing remarks. Again, another quote from Moser. The methods, concepts, standards, definitions, and all other aspects of statistics, surveys, and censuses are the statistician's professional province. And I think that's exactly right, and we need to be re-emphasizing that. And I think the society embracing data doesn't represent a shift away from statistics. Rather, I think it reaffirms where it all started. It re-establishes the link to our roots. to Malthus, to Florence Nightingale, to Beveridge, all those sort of people. So it's a really important thing, I think. So finally, Errol Street. So Council did approve today the sale of Errol Street, and we have an offer on the table. So we're looking to leave Errol Street after a very successful almost 30 years. It's unclear, I don't know where anyone else has figured out, where the playground, I think, would have been in this building, because it was a school going back many, many years. But regardless of that, I think the world is one big playground for statisticians, and for data professionals, and for the society as a whole. And frankly, it's hard to imagine a more exciting time, I think, for the society which, given that we've got a world awash with data, I think even if we've got a few battles with the devil ahead. Thank you.
Thank you, Andy, for a fantastic address. I'd like now to call on the immediate past president, Professor Sylvia Richardson, to propose the formal vote of thanks.
May I begin by congratulating and thanking Andy for his long services to the Society and for all he's already achieved during his presidency. Particularly a highlight has been the 5-year strategy. This important, dare I say, manifesto is a blueprint for our ambitions, and it's blending skillfully continuity and innovation, such as the introduction of this core set of values that you've just shown a minute ago to guide the work of the Society. And I think this is very welcome, this innovation. We have to keep moving and learn from our past and look towards the future. The broad view of statistics and data that Andy expanded in his address is most welcome. And I may hazard to forecast that your clever title, The Devil, the Detail and the Data, will become a catchphrase. Of course, there's a risk that the juxtaposition of devil and data might bring some unexpected comments, so let's be prepared for that. Several past addresses have discussed the broad landscape of data science under a variety of angles, and you've placed a spotlight firmly on the importance of a careful consideration of the data generating process. And you've illustrated this message across 4 areas where the Society has been active, which straddle health, environmental, science, technology, and economics, so emphasizing once again how universal are our endeavors. I'd certainly agree with Ian Diamond that you quoted in your text, that awareness of the importance of data and good data was heightened during the pandemic. But fostering this awareness when we're not in a situation of emergency and growing our power of advocacy in this topic will be a significant challenge for the Society in the years to come. Your championing of collaboration is a key part of the answer. Expanding our strengths in public communication with an increasing number of ambassadors and other initiatives will also be important going forward. In section 2, you describe comprehensively the spectrum of data generating process, which I would qualify as primary data generating mechanism. Alongside these, there are subsequent treatment of data, what I would call data enhancement, that I'd like to mention. They build on the primary mechanism, but in order, one might say, to increase the information content of the primary data. And these are also important, and it's an area where there's been considerable development of statistical thinking, because it's been generally acknowledged that good data, i.e. data, sufficient amount of data obtained through a clear process, documented and designed to address a question of interest, is rarely readily available. So we have to develop other tricks to actually achieve, in a way, better data. One interesting example is the fast-growing area of trial emulation. Trial emulation starts typically with routine clinical data and aims to compare effectiveness of different treatment strategy as they're applied, and the aim is akin to a pragmatic RCT. To remedy the potential biases of using such observational routine data to estimate treatment effectiveness, a careful strategy of mimicking the steps of RCT is then applied to produce a derived data set suitable together with a precise statistical analysis plan. So really, the name trial emulation. This emulation process, we typically discard some of the data. For example, we might focus on current users and not prevalent users. So it leads to a data generation process, which is a convolution of observational data and a purposely designed subsampling. And so long as clear principles are adhered to in the subsampling and also in the analysis, for example, using suitable propensity score matching and so on, such an approach enhances the information content of the original data to address important clinical questions. So there's hope in sort of combining different processes to actually be able to go a bit further with our sources of primary source of data. In your discussion, you rightly point out that administrative data is often not adequate to answer many research questions, so limiting their potential use. I would nonetheless argue that in our statistical toolbox, we have an approach that can be usefully deployed to empower the use of administrative data for a wide range of purposes. One such approach, you wouldn't be surprised if I quote that, is Bayesian data synthesis. It enables, for example, a principal combination of aggregate administrative data with richer but much sparser, typically individual level surveys, with a view to account for potential sources of confounding and aggregation bias. And then through this synthesis, you're then able to estimate health effect of environmental, socio-demographic factors, and so on. There are many examples. Data synthesis is also highly relevant to the current debate on census and whether to continue with the organization of, as you illustrated, this very labor-intensive population census, or alternatively to underpin future population statistics through an interface of administrative data and specifically designed rolling surveys. To round off my comments on the data generating process, I really welcome the importance that you've put on the metadata and accurate description of the data journey. One area where clarity of the data journey is particularly important is data visualization. We all know that visualization is key in public communication for bringing to life important topics in science and social science and engaging a wide audience. And during the COVID pandemic, we saw how clarity and accuracy of the supporting data visualization, which accompanied the regular briefing by the Prime Minister, the Chief Medical Officers, and the Government Chief Scientific Advisor, were critical in maintaining public understanding and public trust and confidence. But we also saw what happened when the opposite prevailed and that the visualization was misleading. I recently came across an interesting description of good practice used by the Scientific American magazine for creating transparent and traceable data journey to visualization, with nice example on COVID-19 and climate change. A key message that on metadata that you emphasize is you need a clear definition of the metadata associated with outputs. And I cannot but wholly agree with you. When the output is a measurement, or measurement interest involves some statistical processing more than just, simple transformation, as it's often the case, then sensitivity to different choices in this processing ought to be part and reported as an output. And I think this is a message we would deserve to be emphasized. For example, in your first three examples, the choice of the smoothing window and illustrating how that makes a difference is good to present. The choice of adjustment variable when you estimate, for example, if you try to estimate the baseline for excess deaths, another of your example, again, there are different choices, and this choice will have an impact, and this should be also discussed. And similarly, as you discuss the granularity which would be useful, and the implication of what granularity you choose to illustrate measures of inflation. The conceptualization of this data journey and how we travel from the primary data generation is a topic of, it's a complex topic, but it's a topic of much interest. And in a way, it's part of the broader veridical data science framework that was originally proposed by BNU, and they've got a recent book on that, and I think that's a very interesting area. Finally, I would like to turn to your insightful discussion of generative AI, the so-called hallucinogenic, I managed to pronounce that, effect, and the consequent danger for erosion of true knowledge. I think it's clearly of paramount importance that we add our voice to the growing discussion of issues of policy and governance in AI, currently taking place in the worldwide data science community and many other forums. This is an area of a significant advance, both in practice and legislation, will require massive joint efforts, combining technical, legal, ethical, philosophical expertise. So I would advocate for the society and its AI task force to join forces with national partners like Turing, the Alliance of Data Science Professionals, as well as international initiatives. And I came across to a recent special issue of the Harvard Data Science Review on grappling with the generative AI revolution, and its editorial on Future Shock by David Leslie and Charlie Meng. And that's a fascinating read. They bring out a vast and detailed list of subtopics which are outlined, both technical and societal. And it highlights eloquently the multiple issues that the generative AI revolution is posing, and acts, I think, as a call to arms for all data scientists to get involved. And so strengthening the voice of the RSS in this debate, and possibly, really contributing to issues like that, because I think the way they have really outlined lots of possible topics is already a step forward to try to get people to think and bring their expertise on some of this topic. And so strengthening the voice of the RSS in this vital debate in a collegial way, as you have proposed, I think is clearly timely and a priority. The President has delivered an address that covers issues of great importance for our future as statisticians, as data scientists, and as citizens of the world. And it gives me great pleasure in proposing the vote of thanks and congratulating Andy for his very stimulating and thoughtful address.
I'd now like to, well, thank you, Sylvia, first of all, and I'd now like to ask the next past president, Professor Deborah Ashery, to come and second the vote of thanks. Deborah.
Thank you. I think after this I get properly pensioned off. So I too would like to thank Andy for his thoughtful and challenging presidential address tonight. Like Sylvia's, who gave hers in 2022, it is strongly influenced or rooted in the experience of COVID. And interestingly, both of them touch on the REACT studies and the recovery trial. Now, in my remarks on Sylvia, I thought about how those and their sister studies, how they were able so rapidly, through a combination of statistical scientific preparedness from previous studies, and the phenomenal rapid collaborations between academic, government, and private partners. Looking at these now through the lens of the Society's new strategy, which Andy has emphasised, I think those kind of collaborations actually exemplified our values, now that we've made explicit, of being inclusive, collaborative, impactful, and progressive. So I really like those new values for articulating that. I want to focus a little bit on the first of these, being inclusive. And it's kind of a recurrent theme in the written version of Andy's address. But I particularly want to focus on it tonight in statistical context, which is not to downplay the other sorts of ways we want to be inclusive. And in his concluding remarks in the written version, Andy actually put it very succinctly, and he was talking about statisticians and data professionals, and said they also need to understand what is not being collected and why. Now, very often as statisticians, we look at missing data, missing observations, and we have boxes of tricks for trying to deal with those. But I'm actually most concerned about the people who don't make it in at all, those who are invisible or nearly invisible, even in routine data sets. Perhaps those who are distrustful of official systems, so they choose not to engage, or at least they don't share more personal characteristics than they absolutely have to, or they choose to opt out of NHS systems, or they don't have easy access to healthcare, so they never get anywhere near their doctors at all. And so they miss out both on the healthcare, but also contributing to data to help manage and improve healthcare. So why does that matter? We've still got more data in there than we can possibly cope with. Well, it matters because, for example, if certain groups of people don't engage with the census, then we are at risk of undercounting populations and therefore not providing a fair share of resources to the communities who may need the most. It matters in studies such as REACT and the ONS survey, but also in later stage trials, because we have a poorer understanding of those groups who are not fully participating, and so we have to rely implicitly or explicitly with our fancy models on extrapolating from those who do participate. Andy touched on smart data, and there are real differences in those who have better access to technology and the willingness to engage all it has to offer. You can order a cup of coffee or a full meal on an app and pay for it through there, but only if you're digitally literate, I struggle with some of that, and can afford to run a smartphone. The same goes for online shopping. So those who can't or choose not to participate neither benefit nor contribute their data. And this matters even for conventional statistical uses of data. But artificial intelligence also relies on increasing digitalisation. And so it's going to matter equally there if it's based on existing data and other kinds of inputs, which come more extensively from some groups than others. Omission of those marginalised groups affects generalisability of conclusions, leads to the risk of further perpetuating existing inequalities, and the lack of access will itself further reduce the ability of those marginalised groups to engage and benefit from our digitalised world. Now, I'm preaching to the choir here. Statisticians are often well aware of these issues, and so will investigate, document, and maybe attempt to adjust or extrapolate using good methods or triangulation. We need to ensure that those playing with the shiny new toys of AI take the same rigorous approach. And I really welcome Andy's focus on what he calls inputs to highlight this. Now, picking up just one other topic, I'm delighted that Andy picked up on my rather too brief mention of climate change and the role that statistics and statisticians might play. Well, actually, he thought of it himself, and I remember saying, oh, I touched on that in my address, so he's quoted me. I really, therefore, enjoyed how much he's developed it, brought us some beautiful, pertinent history, and then bringing it up to date, looking at the really recent reports, and clearly highlighting the role of data in describing, monitoring, and determining action, but also highlighting some of the outstanding issues that need addressing. So, as a society, we're often very good at dealing with the acute and the urgent. In my own sphere of health, clinically, the NHS, despite the strikes today, if you happen to have a heart attack or a stroke or an accident, you would get treated. But the NHS really struggles with more preventive approaches, which require a longer-term perspective and investment. In the intertwined worlds of research and statistics, as I mentioned at the beginning, COVID really showed how we can mobilise rapidly in the face of a pandemic, and our society played a pivotal role in that. The challenge we now have, and I think Andy's address goes some way towards starting this, is to put that same intelligent expertise and energy into the slower burns without losing momentum, and climate change is a brilliant example. The Royal Society has a huge amount to offer, and Andy's address really shows that. So, drawing on our roots and values, Andy's address demonstrates beautifully how the society continues to be relevant in dealing with contemporary issues, with the skills to make the best use of data resources that digitalisation offers, despite all of the devilment in the detail that the data brings. It gives me enormous pleasure to second the vote of thanks.
Thank you very much, Deborah. Before we finish, I want to make sure that everyone knows there's a reception downstairs in the council chamber, which we hope everybody here will join us at. We now have a proposed vote of thanks and a second vote of thanks. So I think we should all thank Andy for his excellent presidential address this year.